Gorosky, 72 years old. My dad died when he was building a house for us. He died with a heart attack at age 50. I was just turned 9 years old. So I'm going along, having a great time. Everything was just going beautifully. And then I wake up one morning and he says, I don't feel so well. And my wife looked at me and she says, you're all white. She says, we're taking you to the hospital. When they got in there, the doctor says, you had a heart attack. I said, no, it can't be. They look at me in the hospital and they see that I have got blockage. I've got 100% blockage on the right side of my heart and about 50% to 80% on other parts of my heart.
Bob has had a heart attack, a myocardial infarction, that he has survived and done rather well with. But now he's faced with having a chronic illness, and he has coronary artery disease, and he has blockage that he's going to be left with for a long time, as well as a tendency to develop future blockage, and needs to take steps to make sure he doesn't have another heart attack.
When we realized that we need to shift our mindset, it's an opportune time to take action according to strong intentions and very clear commitments. Bob realized that he really had to modify his strategies, and he had to take some new steps, some new courses of action in order to be able to deal effectively and constructively with the health crisis that he had.
What we can change is our health habits moving forward, and that relates to working with your doctor to be taking the right medicines, to be eating the best you can, to be getting the right amount of activity. Exercise and diet are incredibly important parts of management, and so patients need to be engaged in their own care.
I took up the swimming where instead of just splashing around in a pool with the kids, I actually did laps.
Bob realized he had to come to terms with stepping up his exercise. Splashing around in the pool wasn't going to do it, so he decided he had to take a stronger course of action.
The key is to find something that you really like to do, that it is not an effort. Then it's easy. You just do it. I had a lot of people in my life that affected me, inspired me, and so on. That's one of the things that I always keep in mind.
We need to stop and reflect on our successes and our learnings. We need to reframe our project, looking at the data. What do we know different than we knew yesterday? And then revise based on our learnings from our reframing. And lastly, refocus. Never stop improving.
If you spoke to any one of his friends, they would all say the same thing. The man is amazing. He's our idol. We're proud of him.